Welcome, friends. I am Dr. Sarthak and in charge of the critical cardiac care unit at Narayana Health City, Bangalore. Alongside me is Dr. Praveen P. Sadarmin, an eminent cardiologist with more than a decade's experience of treating cardiac patients at the same place, Narayana Health City, Bangalore. And together we welcome you all on this forum on the occasion of World Hypertension Day, which is coming on 17th May. And we will be discussing a very relevant and important topic, that is hypertension, and how it's linked or how it manifests, what are its relation with coronary artery disease and other problems related to the heart. So going forward, welcome, sir.
Thank you, Sarthak. Thanks for the introduction.
And so the first question of the day, what exactly is hypertension?
Good. I think, as you mentioned, it's a very, very relevant topic. And given that hypertension is so common, everyone knows about it. But I would say people don't know about it. Right. Because it's like the elephant in the room. Because everyone knows there is blood pressure. Yes, I got blood pressure. But once again, no one knows exactly what are the implications, what we should do, or how to look after themselves or their loved ones. So it's quite relevant that we talk about this topic on this important day. Right. And hopefully we're going to bust some myths. There are a lot of myths about, obviously there's myths with any topic, especially health topics in a country like India. But I'm hoping that we're going to successfully bust some of the myths and then also help people make some good decisions, and then they can take some timely help if necessary.
True.
So that's the main intention of this talk today.
So what is hypertension per se?
Hypertension, the basic definition is high blood pressure. Okay, we all have blood pressure because that's quite important of how we function. Without blood pressure, obviously we are dead. So there is some cutoffs. How do we know these cutoffs are right? Because there are lots of studies that has been conducted.
Yes.
And what we call these scientific forums or the health societies like Cardiac Health Society, Hypertension Society, all these societies come up with guidelines based on this scientific evidence. That's when we see where there's a cutoff of blood pressure. For example, everyone knows about 120/80.
Right.
Okay, that's the most commonly talked about blood pressure number, but it is usually a range. Okay, and obviously it depends on what we are doing. See, blood pressure will never be static, so it cannot stay as it is. If we are resting, the blood pressure goes down. If we are doing something, if you are walking, if you're talking now, the blood pressure is slightly higher up.
Right.
So that is what we call a physiological response. So it is quite important that we diagnose hypertension, because that's the first step. To accept there is a problem, we need to know there is a problem. Then we can find a solution for that.
Yes.
So that's going to be very, very important. So that first step is the diagnosis of hypertension.
And how prevalent or how common is this problem of hypertension that you see in your day-to-day practice?
It is one of the most common diseases of probably, in the world. Diabetes, hypertension are the two most common. Obviously, heart disease tops that, but once again, everything is interlinked.
Right.
So these are the two strong risk factors for heart disease. Diabetes. In fact, India is the diabetic capital. India is also the hypertension
capital of the
world. So a lot of people are being diagnosed, especially the younger population. I mean, how we define young is once again quite different because we keep changing the goalposts. We got a healthy 60, we got a healthy 70. But, I'm talking about the prime of people of the prime age. So 30 to 50 years of age. And in my day-to-day practice over the last probably 5 years, I am seeing more and more patients being diagnosed with high blood pressure. Is that because of stress? Is it because of food habits? Probably it's a combination of everything else. Right. So rather than, there's no one single factor, but multiple reasons do lead to this problem. And obviously, the longer you have high blood pressure, you run into complications with it.
Right. So just going ahead on the same vein, why exactly do we need to treat hypertension? Let's say somebody has got a blood pressure of 150, 90 and the person says, I feel perfectly fine, I'm comfortable, I don't realize that any problems. Why should we treat that?
Correct. See, that's a very, very valid point, because hypertension is not like other problems where you get symptoms. Most of the time it is asymptomatic. You're absolutely fine. you don't even realize that you got blood pressure. Very interesting study which came out a few years back where they looked at healthcare professionals, like you're talking about doctors, nurses, people who are working in the hospital. What they found out was that there was a 30 to 50% risk. 30 to 50% of people who already have high blood pressure and dyslipidemia, like high cholesterol, without even realizing that they are hypertensive.
And they are the people who work in a hospital.
So you can imagine, if this is a state of people who work in the hospital, imagine the lay people.
Yes.
Where there is an inertia to kind of check your blood pressure or go to the doctor,
Yes.
especially when you don't feel unwell. If you feel unwell, yes, you're going to get up and go and see the doctor. If you're feeling perfectly fine, your blood pressure may be running at 150, 160 all the time. And
Yes.
you will not even realize.
What are the problems that can happen if it's at, let's say, 150 or 160 systolic for months and years together? Why do I need to get it under control?
Correct. So the four major things that can happen with blood pressure over a period of time, which is untreated, would be ischemic heart disease. People will develop heart problems, heart attacks. So that's one of the most important things. Second would be heart failure. The heart, not able to cope. Usually it leads to a stiff heart. After that, hypertensive heart disease, and then the heart starts to fail. So that's what we call heart failure. The third and most important thing is kidney problems, because once again the blood supply to the kidney can be affected. Less of blood supply, the kidney starts to shrink, the kidney function goes down, and then it's an irreversible process.
Irreversible, true.
And other important thing would be strokes.
Yes.
People with high blood pressure have two types of strokes. One is that they have an emergency. Obviously, there is a bleeding in the brain. It causes lots of damage. Obviously, you know how devastating a stroke
Oh,
is.
yes, yes.
So it changes your life forever. Or they'll have silent mini strokes, very, very, very mini strokes, like strokes, where they'll not even realize that they're having strokes, but the damage has already happened. This continued over a period of number of years will lead to vascular dementia. That has definitely been shown even in normal dementia, where people think, okay, fine, I'm getting older, I'm getting slower, I'm not as sharp as I am.
But it's because of the mini strokes.
It could be because of the mini strokes. So you treat them, at least you prevent further insults.
Yes.
So that is a very important point why we need. Other than that, obviously, eye problem is a major issue. People go blind with untreated hypertension.
True.
So there are multiple reasons, but these are the important ones I kind of told you. So it makes it all the more important that we look into that, because there's a mortality and morbidity.
Both.
So some people might argue, okay, fine, if someone is dying, okay, I don't care. But it's not about death. It's about how good you are when you're alive.
What is your quality of life?
Correct, absolutely. So that is very, very important. So
Yeah.
we should never forget about quality of life. Morbidity is very, very, very important.
It's more psychologically damaging than the death
Correct.
per se.
Correct, true.
Somebody in their prime of life and suddenly has a stroke and they are unable to take care of themselves.
I remember vividly one of my patients in UK when I was practicing there, 40-year-old lady, totally, and it was her birthday or something, and obviously there was a bit of a party, and she came in suddenly in the middle of the night with a massive bleed, cerebral hemorrhage, so bleeding into the brain, and then after a few hours she died. So totally undiagnosed hypertension. So she had high blood pressure. She was never aware of it, so didn't take any medications. The blood pressure was 230, 240, and unfortunately she died with a very small kid. So it's a very devastating thing.
Devastating thing to happen.
So,
True.
She thought she was totally healthy. So that it can make a huge difference.
How do you go about diagnosing this? I mean, if it's asymptomatic, it becomes a little difficult.
Correct. See, that is the reason people after the certain age, I mean, initially used to say 50, now I say at least 40. If you hit the age of 40, you should have annual checkup. Annual checkup will include, checking your blood pressure, checking your pulse rate, getting an ECG, echo, and some few blood tests, checking for your cholesterol, diabetes. So those are things. Definitely an annual checkup is required for all of them. If you don't have any type of symptoms, obviously you go sooner. And one of the common things that I hear from people is that, fine, I got blood pressure, I come to you, and they're sitting in front of me. And they say, okay, I tell them your blood pressure is a little bit high. Oh, don't worry, doctor, I get nervous when I come to the clinic. That's the most common statement I hear. But once again, As a doctor, I need to think about, okay, fine, is this only a physiological response, what we call a white coat hypertension? When they come to the clinic, when they see the doctor, their pressure goes up, which it is very true. It is
Stress induced.
definitely. There's a good amount of people, maybe 30-40% of them will have white coat hypertension. But is it because there is already underlying hypertension and their blood pressure goes further up when they see me? So that is what I need to decide, and that is when I ask them to take multiple readings. And obviously we have the luxury of what we call a 24-hour blood pressure monitoring, which is more accurate. You take it home, you do it. It is an automatic machine, so it checks your blood pressure, and then after 24 hours, it gives me the reading.
True.
Or multiple readings at home, because now people are able to buy a machine at home which is reasonably accurate.
Yes.
And these machines, it will give pressure. So I ask them to do multiple readings, and when they do multiple readings, we can get an average of these readings and then say, fine, is it under control or out of control? Then I can think about initiating medications or up titrating medications. So those are the things that I look into when I see a patient.
So yes, as you pointed out, getting an ambulatory BP monitoring for people who say that their BP shoots up. Another point there, if their BP shoots up when they come to the clinic, their BP would very well be shooting up every time they land up with the slightest bit of stress.
Correct.
So that means they have the tendency to
they already have that problem, and probably it's a little bit exaggerated when they come to the clinic.
So how do you go about managing this problem of hypertension? What all is a person supposed to do? Let's say somebody gets diagnosed or feels that they have hypertension. What are they supposed to do, and what happens when they come visit you?
Sure. So that's the most important part of my medication. The first thing, I'm going to assess the risk, what I call the cardiovascular risk. So rather than just treating hypertension in a single way, like in isolated manner, I would treat them, I would look into all their cardiovascular risk factors.
Right.
If the risk factors are high, for example, if they have associated diabetes, if they have heart problem, then I'll have to be more aggressive. Especially diabetics, we tend to treat them more aggressively. It's just because two insults, hypertension and diabetes, causing more problems on the what we call as end organ damage. So kidneys, your eyes,
kidneys,
heart, everything. So those are the things that we need to look into. If someone assumes, if someone has got only isolated hypertension, nothing else, I start them on, routine management. So my management will include non-pharmacological measures. So I tell them lifestyle modification is the key. Make sure that, because, it is very difficult. It's one of the most difficult things. You ask patients to take a tablet, they're very happy to take tablets. Okay, that they think that that's where their responsibility ends. You ask them to make their lifestyle changes, that is much more difficult.
What do you mean when you say lifestyle modification?
So diet is going to be really important.
Okay.
Obviously more of fruits, vegetables, less of meat, alcohol, stop smoking, exercise. If someone is already exercising, do a bit more. If you're not started, start slowly, gradually build up your endurance. Exercise is one thing where I have seen patients who actually genuinely take up exercise, and then to a moderate level, their blood pressure comes down very beautifully.
Yes.
Salt reduction has made a huge impact as well. One of the things that we don't appreciate much is how much of outside food, I'm saying outside meaning packed foods, or where
processed
foods.
You mean?
So they use a lot of salt in it.
Yes.
Because salt is a preservative.
True.
So that's where your BP shoots up. You have a packet of crisps, your BP is going to go up, and people obviously they make it so tasty that you can't stop at one. So you go for something else. You go for another packet. Those are the kind of behavior that we need to avoid. I'm not saying don't enjoy life, but there has to be a bit of a balance. So you need to understand when to stop. Okay, getting your cholesterol under control, because once again that is another risk factor that is going to affect your cardiovascular risk. Once these lifestyle measures have been implemented, if they're still not able to maintain a good blood pressure, then I initiate them on medications. The other thing which I'm probably over the last few years doing more and more is trying to address the stress problem. Obviously, I may not have an answer to all their stresses, but at least things that I've advised them and which has helped is doing yoga, meditation, and breathing exercise. those things would definitely reduce their stress levels and patients are able to manage. I've got a collaboration with a couple of psychiatrists who they are very good at counseling regarding stress. Not necessarily put them on tablets, but where you can actually counsel them regarding how to manage stress. That is becoming a key in my practice, especially with young people, software engineers or any profession. It doesn't matter from one profession to the other profession. All the professionals are under stress.
True.
Maybe when I was a medical student, I didn't understand, or probably I didn't even appreciate that there was so much stress. Maybe things have changed. So we need to adapt as a professional giving care. We need to adapt ourselves to see what we can do to make their lives better by addressing the stress. So domestic stress, office stress, work stress. So all these
and
things
how they cope with that stress.
Absolutely. The stress is something you cannot avoid. It all depends on how the person deals with that stress. So that is going to determine, what is the risk that they're going to encounter themselves.
Great. So that's very important. Management of stress, a proper diet, and definitely exercise. With that, the pressures can be controlled along with the regular usage of medications, of course.
Correct.
How is this problem of hypertension linked with cardiovascular diseases or coronary artery disease?
Sure. Sorry, I just remembered one other very important point that I want to discuss before I'll come to this.
Yeah.
One of the things that most patients tell me is, that's what they do as well. I start them on tablets, and obviously they take it for a month or so, and then their blood pressure very nicely comes down. They feel very happy about it, and then they stop the tablets. They don't come for follow-up. It's such an important thing.
Yeah, they feel that now the job is done. It's like
Correct.
You have got infection, you take some antibiotics, you are cured. So
Correct.
you don't need to take it any further.
Absolutely. See,
That's the myth.
Absolutely, it's a myth. So it doesn't work that way. Hypertension is a continuous process, so you need to control your blood pressure all the time.
True.
Whether you control it by non-pharmacological measures or you control it by tablets,
Or a combination of both.
Or a combination of. Usually, it requires a combination
of both. True.
That is perfectly fine, but make sure your blood pressure remains under control. There are a few patients where I have stopped medications as well, but they're very well educated in terms, not necessarily their education, but educated about hypertension. So they know, they check their own blood pressure, they are under constant follow-up. Worst case are the patients where they stop tablets on their own, they don't come for follow-up, and then I see them after a few years where they landed with a complication, either with a heart attack or
so basically
stroke.
They have not taken care of themselves.
Absolutely. So the key message I want to give today is, because one of the common things that I get asked, are tablets for life? Yeah. I'm afraid the tablets are for life unless you are able to control those risk factors.
Which most of the time you will not be able to. So
Correct.
Make peace with it.
Absolutely. So, but even if you're stopping tablets, make sure you're under the follow-up of the cardiologist. That is also
and do a proper regular BP checkup of
Correct.
yourself.
Correct. So regarding your other question,
the link between hypertension and cardiovascular disease, how are they linked?
They are very intricately linked, because once again, as I told you, the four more dreaded things that we worry about hypertension is ischemic heart disease, which is a heart attack.
Yes.
Second is heart failure.
Yes.
Third is strokes, and fourth is a kidney problem. There's this very, very strong link between heart attacks, ischemic heart disease, cardiovascular disease, and hypertension. So there are 2 or 3 very, very strong factors that I can point are diabetes, hypertension, smoking.
True.
There are multiple risk factors that cause heart problems, but all of them contribute to only certain extent. For example, if there is a very strong family history of heart disease, your father, mother, brother, sister, uncle, aunts, then you have only a maximum of about 10% or so of inheriting that risk.
And you cannot control it.
You cannot control it. But these 3 factors, they can individually cause you the heart problem: diabetes, hypertension, smoking. And the good thing about these 3 factors are, these are modifiable risk factors.
Yes.
And the one which I told you earlier, family history is a non-modifiable risk factor, which you cannot do anything. But at least, we do know there's a problem and we can do something about it. That's the beauty as well.
True.
That is why we need to focus more, we need to emphasize more, saying see, there is a problem. You identify the problem, you identify the solution, please implement it.
True.
Unless you implement it, nothing is going to change.
True.
Okay. So there is a very, very strong risk of heart disease, especially heart attacks with hypertension. And maybe that is the reason why we are seeing so many heart attacks in young people as well. Because one, either they are undiagnosed or they're getting hypertension at a much younger age. Previously, hypertension used to be a disease of 50 plus.
True.
Now 20s, 30s, late 20s, 30s, it's become very, very
Which was
common.
very rare. Even 10
Absolutely.
years back, it was absolutely
Absolutely,
rare.
it is very rare. It's only in the last 5 years that I'm seeing more and more patients in the kind of, as I told you, this is the prime of their life,
Yes.
30 to 50. And if they're already, assume they get hypertension at the age of 30, they're going to get complications by the 40, 45.
True.
15 years of hypertension.
Unless they get it
Definitely.
well controlled.
Absolutely. But most of them, either they don't know or they don't take proper precautions and follow.
Right.
So they're losing prime years. So once again, they might be the breadwinners of the family, or they may have young kids, because once again, we've seen a societal change where people are getting married later, having kids later. So assume if you have a disease at the age of 50, you may have very young kids.
Yes, you have to be even more careful.
So who is going to look after these kids? And if you're the sole breadwinner of that family, and you end up in hospital, or you end up using all your savings for treating yourself or your loved one, it's a huge financial burden on the family. So that's something we need to think about.
True. On that note, we will end the session. Thank you everybody for listening. Hope you understand the relevance, the importance of diagnosing hypertension early, understanding what hypertension is and what it can lead to, and take care of your loved ones and yourself. Have a great day. Thank you.
See you. Stay safe.